All right, well, most pharmacists wanting to demonstrate their competency usually desire to pass one of the BPS specialty exams. But what separates those who do pass from those who don't? It's not luck, guys. It's about being strategic and purposeful in your preparation. Hey guys, I'm Dr. Busti, your faculty and host on This Is Why, a show that helps healthcare professionals transform their medical knowledge from knowing not just the what, but knowing the why. The why here is centered around how to best prepare for one of these exams and pass on the first try. Within that discussion, we're also going to take a look at the pass rates for the most common BPS specialty exams and known predictors of first-time test takers who's passed. You're going to walk away with a clear picture of how to measure your readiness and what to change in now as it relates to your study plan so that you can maximize the success of passing. Now, before we jump into that, let's take a minute and look at the trends and pass rates for these BPS specialty exams, because the trends or averages do matter, and they actually tell us something real important. Okay, so from this table, you can see that on the far left, okay, this is the year. It goes all the way back to 2015, okay? So we're trying to get a 10-year snapshot so that we can see trends. And then each column therefore represents some, again, the major, more commonly ones that are tested of the BPS exams. When you see a dash or an empty space, that's typically either the data is not available or that wasn't on the market yet. Some of these tests are newer than the other tests. Okay, so there's just no data there. And then at the bottom here, you see that the average at the final row there in dark blue is the cumulative sort of average across the 10 years to kind of give you a snapshot of, you know, how things are looking. And what you see is, man, the pass rates are not that great, especially when you compare board exams of other healthcare professions. The scores are much lower. Some of them drop below even 60%, like you see here for cardiology. Some exams started out high, probably got the experts to take it first, right? But you can see they've gotten some dipping down into the 40s%. Saw the same thing with critical care. Started out pretty good. It started to drop, okay? BCPP, several's in the 40s, okay? And then BCPS, which has been around the longest, one that I took, okay? It's kind of hovered around the same kind of bubble, right? That 60 to 65% window, okay? But when you look across all of these, almost 30 to 50% of people taking these exams fail, just don't pass. And these are practicing, obviously, you guys know this, these are licensed practicing pharmacists, some with residency training, some without, some with a certain amount of experience, because you have to qualify to take the exam. I qualified because I did a residency and I took it right away and fortunate enough to pass on the first attempt. And I learned a lot from that experience, which is one of the reasons why I want to talk to you a little bit about strategies and predictors of success so that you can pivot, adjust your study plan to maximize your chances of passing. But these statistics are slightly discouraging. I mean, it's an expensive exam, costs a lot to do a review course, and then it's just a delay in that marker or indicator that you would like to promote that demonstrates something objective about your level of competency, especially those of you in a specialty area. So this means that we've got to be studying with the right frame of mind. We've got to be using the right tools, understand the rules of the game. What is testable? What is not testable? What are the predictors of success? And that's what we're going to continue to discuss here. We're going to jump into these predictors, but hear me. This is not meant to be definitive for every one of you listening. It's going to, obviously everybody comes from a different background, levels of experience, training, all that stuff. But these factors that are kind of known or have been discussed, some of them are found in the literature, and they're there to be predictors of success. So apply them where they're applicable to you. All right, so there have been some of these that have been studied a couple times, and so you see a story, a pattern. And I love it when we have multiple studies that show the same basically outcome, or they look similar, because that's probably, the truth is somewhere around there. But one of the things that's out there that's pretty well established is that residency trained candidates perform better than non-residency trained candidates. Those that are residency trained, PGY2 level, okay, so 2 years of residency, do better than everybody. Even candidates who have a PGY1 residency plus at least 2 years of experience. When you compare both people with residency training, even with some degree of experience, they do better than people without a residency and at least 4 years of practice experience. So again, PGY2 trained do the best. PGY1 plus even just 2 years of experience don't do as well, but next in line, and both of those groups do better than non-residency trained. Now that's not meant to say that those of you that are listening to this and say, well, I'm not residency trained, I'm doomed. No, that's not the case. I've helped develop high yield med reviews and been a part of exam reviews, and I've seen non-residency trained clinicians easily pass these exams if they follow the strategy. So don't go there, okay? But why does residency training seem to give such a clear advantage? Well, the reasons are obviously multifactorial, right? But residency training benefits include obviously being exposed to a more diversified range of clinical experiences. The exam is not just about 1 or 2 disease states. You've got to be exposed to other things, even within specialties. Okay? Mentors from people who are typically experts in that area, right? They tend to be the residency program directors and the preceptors. Those people typically are the experts who are instilling in you the knowledge and the understanding, the depth, so that you're understanding things at a higher level that apply in a critical thinking way. The other thing is that you're having a exposure to other healthcare professionals, including your own peers. So there's some peer pressure to be knowledgeable and to perform on rounds or in clinic, in conference, and all these things. All right. Now again, don't let these things to deter you or negatively impact you. We're going to get over them. But some other predictors that need to be considered, maybe with a little bit less evidence, have to do with those who are repeated test takers. Well, they obviously have lower pass rates. So some people are good test takers, some are not. Some are prepared more than others are not, right? But those who fail, something's wrong in the strategy. And that's what I'm trying to address. Even if you don't know yet where you are, I'm trying to point out those things that you need to self-evaluate, right? But there's clearly obvious apparent gaps in knowledge to apply, or these scores wouldn't be the way they are. The other thing that's out there that's been a predictor is being international candidates. US-based candidates tend to do a little bit better than international, okay? What are not known predictors? Pre-pharmacy GPA, PCAT, even though it's no longer used anymore, but still some of us have been, I had to take it, right? And then your NAPLEX scores. That's not going to necessarily correlate your chances of passing these exams. So again, while the pass rates are low, right, there is something there. So what are some of these predictors that are out there? All right, so it's my personal experience having developed, again, high-yield med reviews and helping thousands of pharmacists prepare for and pass their BPS exams, that one of those things that those who don't pass they have one thing in common. They don't prepare the right way. And you're like, okay, that was profound. What do you mean by that, Dr. Busti? My personal experience, having engaged with those people who failed, is that they didn't follow the strategy. They studied the wrong material. They did not have a diversified study strategy exposing them to a wide range of topics of varying levels of difficulty. They also ignored the recommendations and understanding of biostatistics and evidence-based medicine principles. You're going to have those questions. You're supposed to interpret the literature. So if you're preparing for one of these boards, which I'm obviously assuming you are if you're watching this, then you should be doing what is being expected of you. That means you should be doing practice exams and a lot of practice test questions to force you to apply the core concepts from a number of levels of angles, perspectives, and level of difficulty. So, again, think about it. Basketball players don't go out and practice by playing tennis. They shoot hundreds, if not thousands of baskets, and they scrimmage and play the game. So you should focus on what is testable and understand why the answer is correct. Not studying what you think is important, especially if you've never taken the exam or you're not involved in the committee of developing the exam. How do you know what's on there? You need to read the rules or get somebody who's helped people do that to create the strategy and point you into the direction so that you can play the game with the right rules and strategies to win. If you haven't had time yet to listen to my lecture on what is testable and why are some of these issues occurring, please take a moment to listen to that, because that's a good topic. Because I think a lot of times people, again, who think they know what should be on the test are disappointed because they get to the exam and they're like, but that wasn't on there, and I know. Okay. And so, again, that's one of the reasons I've put together This Is Why. We're teaching people to understand why they do what they do, why High Yield Med Reviews is there, and we've been successful at seeing thousands of pharmacists pass their exams, okay? But here's the thing, guys. Even listening to lectures, reading guidelines, maybe even getting a book, that's not going to be your solution, right? That's not going to get you across the finish line. Those tools are helpful, and they're needed at times, but you must be doing the things that's prepared of you, right? And so that's the program at High Yield. You get pre-tests and encourage you to do Q banks, and then there's post-tests to reassess your application, and those questions are different because every exam that you're going to be exposed to, and even your colleagues, is going to be different. So stop hyper-focusing on exam blueprints and when it was updated, and they're vague anyway. Stop focusing on what your colleague saw on their test. You're not going to get that test. Stop focusing on things that you think are important, that are clinical minutia, that are not testable. So I hope that you found this to be helpful in guiding you and pointing you and encouraging you. These are the things that I've seen that work. People who succeed understand these predictors, and they understand if they don't apply it, the predictor doesn't apply to them, they know how to adjust the strategy, or they've listened to somebody who has helped guide them in that. And that's what we're here for, to invest in each other so that we master the how. And mastering the how in this case is, how do I take and successfully pass one of these BPS specialty exams on the first attempt? All right, guys, let us know how we can help you, and we'll see you next time. Take care.